Are you suffering with sciatica, or maybe you're wondering if you have sciatica? You have pain down the back of your leg and you're wondering if it's true sciatica or if it's something else, if it's piriformis syndrome, or what's going on with you. Well, today we're going to talk about what sciatica is, what causes sciatica, the symptoms you'll be experiencing if you have sciatica, as well as a simple test that you can do right now to see if you truly have sciatica symptoms. I'm Dr. Amy with Physical Therapy for Everybody, and I am a specialist manual physical therapist, which means I treat hands-on, and I see a lot of patients who are struggling with sciatica or who think they have sciatica and they don't know what to do in those initial steps. So that's what today's video is for the people who are wondering if this is what's going on with them and what they can do about it right now to confirm it. So let's start off. What is sciatica? So sciatica truly is an irritation of the sciatic nerve, and I'm going to pull in my friend here to help me demonstrate that. All right, Captain Jack Marrow is going to help demonstrate where the sciatic nerve is. So it starts actually coming out in between the vertebrae. So these are your lumbar vertebrae, the 5 lowest vertebrae in your spinal column, and they all have nerve roots that come out from them. Most of them will join together to form the sciatic nerve. And then it will come out through this hole here, and it sometimes gets caught in the piriformis muscle. So the piriformis muscle attaches in between the sacrum and the greater trochanter, which the sciatic nerve is right underneath that muscle. It can get irritated either by the intervertebral discs, or it can get irritated by the piriformis muscle. Now technically, if it's irritated by the piriformis, that's called piriformis syndrome, but it's still the same nerve. It's still affecting your sciatic nerve. And it's when that sciatic nerve gets irritated that it starts to cause symptoms, usually from the intervertebral disc or from the piriformis, then travels down the back of your leg until it gets to the knee. When it gets down to the knee, it splits into 2 branches. One goes down the back of the calf, and one goes down the side of the calf. Now, a lot of people who are struggling with sciatica only have symptoms that go down the back of their leg, but some people do have it go all the way down into their foot. So if you're struggling with pain all the way into your foot, it can be sciatica, but for many people it's just to the knee that they have the sciatica symptoms. So why does the sciatic nerve get irritated? Most commonly it's irritated because either a ruptured or herniated disc. Those are just big words. That means that something's wrong with the disc. Okay, it's either pushing out and putting pressure directly on that sciatic nerve, or it's ruptured, so it's gotten outside of the contents are outside of the container, and that's causing irritation to the sciatic nerve. Now, when it's a full herniation, usually that irritation is actually coming from the chemicals that are kind of bathing that nerve. So it's not even the disc per se, it's the fact that the discal material has been released out into your body and it's irritating that sciatic nerve. Now, even though it's happening in your back, you may feel those symptoms down in your leg. You may not have low back pain, even though that's where it's originating from. Because the sciatic nerve does travel all the way into the leg, it also innervates the muscles in the leg, which means you may have muscle tension in the hamstrings, the muscles on the back of your leg. That's how you're experiencing more of your sciatica, as opposed to having any low back pain. Now, if you're having symptoms primarily in your leg and no low back pain, then you might be having an irritation of the piriformis. So if your piriformis, that muscle that runs from your tailbone to your hip bone, that muscle can get tight and it can put pressure on the sciatic nerve. And a lot of people who do just have that leg pain and don't have the low back pain often complain of tension in that piriformis. So it's sometimes deemed piriformis syndrome, but it's still the same nerve. So tomato, tomato, piriformis syndrome versus true sciatica. The sciatic nerve is irritated, and what we're going to talk about for the next 7 videos is that irritation of the sciatic nerve. So if it's irritated by the intervertebral disc or if it's irritated by the piriformis, much of what you're going to hear in these videos is the same, because the truth is the sciatic nerve is still the sciatic nerve no matter where it's getting irritated. But along the way we'll differentiate for people who feel like it's more of a piriformis syndrome versus a true sciatica, which is where the disc is pressing on that sciatic nerve. Now, no matter what you're going to be experiencing if you have sciatic nerve pain is pain down the back of your leg. Now, usually, like I said, it goes to the knee. Sometimes it goes beyond the knee and down the back of the calf is most commonly where people will experience it. But what will happen is that will be a variable pain. Often when it initiates, it's a very sharp, stabbing, grabbing, shocking pain. People describe it feels like lightning going down the back of my leg when it initially happens. Once things kind of simmer down just a little bit, it will be more of a mild, aching, chronic, like stiff feeling, my muscles feel stiff type of pain. So that pain does change for people as the sciatica hopefully is improving. Muscle tension is a part of sciatica. So the sciatic nerve is the one that's irritated, but it innervates those muscles in the back of the leg, which will cause them to be tight. Because you see, muscles are dumb. The only thing they can do is contract and relax. So if you are feeling any kind of pain, the nerve says, hey, look, there's pain, and the muscles do the only thing that they know how to do. That's their defense mechanism. They contract. They will stay contracted no matter how much you try to stretch them if that sciatic nerve is still irritated. So it's very important that you've got to relieve the pressure on the sciatic nerve. You've got to get the sciatic nerve feeling better before you can stretch the muscles and see any long-term benefit. You might see short-term benefits still. It will help to relieve things in the short term, but stretching's not the best thing to do for the sciatic nerve. We're going to talk about that in a later video, but first I want to show you what you can do to test at home to see if what you have is truly sciatica. So this is called the slump test, and it's a really simple test that you can do at home where you're sitting right now to see if you have true sciatica. What you're going to do is you're actually going to sit in really bad posture. You're really going to slump forward. You're going to bring your chin down to your chest. This puts pressure on the nerves in general because obviously the head is attached to the spinal cord, is attached to the nerves in the arms and legs. And so you're pre-tensioning that nerve, basically, is the point. Then you're going to bring the painful leg, you're going to straighten it out. Now that may already cause you to start having some zingers. If it does, then just stop there. You already have your answer. Don't go any further. But if that doesn't really cause any zingers and you want to test it a little bit further, you're going to bring your toes back towards you. Now you probably feel some calf tension or stretching. That's just normal in this position. But if you start to have the zingers in your low back or in your hip, then you do truly have a sciatica problem. So it's a really simple test that you can do at home so you know exactly what's going on with you. If you found that you do have sciatica, you probably want to know what you can do about it. So in this next video, we're going to talk about the best sciatica stretches and the ones that I want you to avoid. So we'll see you there, and I'd love for you to click subscribe.